Good morning, everyone, and welcome to our session this morning. A reminder to everybody here in the room that please turn off your cell phone and put them on vibrate for the presentation. And if for any reason you need to leave the room during the presentation, we would just ask that you walk around or to the side of the camera rather than in front of the view. The washrooms are just outside in the lobby, so that's for our in-person audience today. Welcome to the Children's Mental Health Learning Series. My name is Wendy, and I'd like to welcome everyone who is here in person today, as well as our web audience. Dr. Kris Wells will be presenting today. Before we begin, just a few housekeeping items. To our online viewers, a link to test your system was provided in advance. If you're experiencing technical difficulties this morning, please contact your local technical support. A copy of the slides that Dr. Wells will be using today were also sent out to everyone who registered by email this morning. So if you're having trouble seeing the slides on the webcast itself, you might want to open a copy of those slides and just follow along with the presentation. Dr. Wells will be speaking for about 1 hour, followed by a short question and answer period. We'll have a microphone in the room for questions, and Amy will also bring questions forward from the online discussion room. For our web audience, please post questions using the discussion room feature on your screen. We have a very large web audience today, and we'll attempt to bring forward as many questions as we can. The session is being recorded, and it will be available online in a couple of weeks. And a follow-up evaluation and a link to today's recording will be emailed to everyone who's registered. A certificate of attendance will be provided once your evaluation has been completed. So with those housekeeping items taken care of, I would like to welcome Kiana Chouinard, who is a youth leader with Camp Firefly. Kiana will introduce our session today. Thank you.
Good morning and welcome to the Children's Mental Health Learning Series. This learning series provides free, helpful information and strategies for youth, their families, caregivers, and professionals who support youth with mental health issues. Creating supportive and caring communities leads to greater inclusion and better mental health for all youth. We all share responsibility with this. Increasing information for families and caregivers of youth about a wide range of mental health topics builds our capacity to support young people in Alberta. We know that when youth feel respected and included through healthy relationships, they are more likely to reach their full potential and give back to their community. Healthy relationships and positive cultures occur when we understand that differences are an expression of diversity that should be embraced. Better understanding of sexual and gender identity can help to protect kids, deter and prevent bullying, and promote inclusion. Our presenter today, Dr. Kris Wells, is at the forefront of work on sexual and gender minority students. Dr. Wells is Assistant Professor and Director of Programs and Services at the Institute of Sexual Minorities Studies and Services at the University of Alberta. He will be presenting on supporting mental health in lesbian, gay, bisexual, and transgender children and adolescents. Kris was instrumental in co-founding Camp Firefly. Camp is designed to help youth develop leadership skills and personal resiliency to become agents for positive change in their schools, families, and communities. Dr. Wells has also authored resources on homophobic and transphobic bullying and gay straight alliances. Today's session aims to broaden our understanding of sexual and gender minorities and share recommendations for more just, ethical, and inclusive practices. Dr. Wells is an educator and researcher highly demanded by many organizations across Canada and internationally. He is the recipient of many academic and community awards. His research and teaching interests include vulnerable youth populations and bullying, school violence, and youth resiliency, among others. Please join me in welcoming Dr. Kris Wells.
Thank you. A pleasure to be here with you, the participants here in the audience and those online. I look forward to meeting each and every one of you out there in Cyberland at some points along our various journeys. Special thank you to the Alberta government and the Ministry of Human Services for providing this opportunity to give this talk this morning. Certainly a timely and topical discussion given many of the debates that have been happening in the provincial legislature and within agencies over the past several months. So I hope that this will add another thread to those important discussions. And lastly, a big thank you to Kiana, who's one of our super youth leaders, not only with Camp Firefly, but was instrumental in helping to start and sustain and strengthen gay-straight alliances here in the Edmonton community, is one of our core presenters for our Firefly in Schools program. That is a peer-to-peer education program that goes into junior and senior high schools here in Edmonton and in Calgary with our partners, the Calgary Sexual Health Centre. Nothing more powerful than peers educating peers to become allies and champions for diversity, equity, and human rights. And Kiana is a testament to that fantastic work of what we're able to do when we help to support and empower young people to find their voice and to find their passion. So thank you for the introduction this morning. What I hope to share with you today are really three goals for our conversation. The first is looking at what are some of the trends and the issues when we're talking about LGBTQ or sexual and gender minorities and mental health. Secondly, what are some of the barriers that we need to overcome? How do we develop, for example, a just and inclusive and ethical practice? What does language mean? What does the research have to tell us? What are the trends? How can we feel comfortable asking the right questions with the youth or children that are in our agencies or in our schools or out in our communities? So I'm going to begin with this slide from Rick Mercer. If you haven't yet seen his rant on bullying, I really suggest that you do so. He talks about 300 kids is 300 too many. And that's in reference to the number of young people who take their own lives in Canada each year. In fact, we know it's far more than 300. What we see is a trend that's happening where young people are being bullied to death. The word that's been coined to address that is bullycide. We see new forms of cyberbullying taking place. We see LGBT young people being disproportionately impacted by cyberbullying. We also see new changes to Alberta's Education Act that are going to be proclaimed this year in 2015 that mandate that schools will have to take a greater responsibility when it comes to cyberbullying or bullying that happens off of school property. So it's really important that we understand that the LGBT community needs to be addressed in any bullying intervention programs. In fact, homophobia is often the language of bullying that happens in our schools and communities, regardless of a young person's identity. Rick Mercer talks a lot about the fact that it doesn't just get better. We can't expect things to change on their own. We have an obligation. He gives us a call to make things better now, to talk about strategies, interventions that can help young people, particularly LGBT young people, move from being at risk to being resilient. So the question is, what does it take to move young people from feeling that they're at risk in their schools, their families, and their communities to a place where they can not simply try to survive, but can actually thrive and live up to their full potential. Rather than seeing these young people as at risk, fundamentally, what would happen if we thought of all young people as being at promise? What different kinds of questions would we ask? How would we be, instead of reducing risk, bringing out strength? Instead of talking about deficits, promoting the development of assets. Sometimes the very framing or the very way that we look at issues is the most important, because it asks us or allows us to address different questions, to start from a different foundation, not of negativity or deficit, but of hope and possibility. The World Health Organization estimates that 1 million people take their own lives every year. That's one death by suicide every 40 seconds. In Canada, there are over 4,000 suicide completions. It was surprising for me to learn that the suicide rate in Canada is 3 times higher than in the United States per capita. In Alberta, I was able to pull the most recent statistics from the Ministry of Justice, who were kind enough to share these with me, to give us a little bit of a sense of what's happening, particularly with our young people, when we talk about suicide and suicide ideation. You can see that, for example, we have a very consistent trend here of 5,000 suicide attempts in the province each year and roughly 500 completions. What's quite shocking is the number of young people, the very category at the end of the slide, under the age of 24 years old who take their own lives every year. We see most recently for the 2004 statistics, which are current, I think, as of the end of September for this year, hopefully a drop in that rate. But what we do know is that this rate increases exponentially in rural and remote communities, particularly for LGBT populations that may not have community supports or resources. We know that this is also a significant issue in our First Nations, Métis, and Inuit communities. In fact, the BC Coroner issued a report in 2008 doing a 5-year study of child and youth deaths in the province of British Columbia and found that our FNMI and our sexual and gender minority youth were the 2 groups of youth most at risk of death in the province of British Columbia, and called for a strategy to be developed to help to reduce that risk. Unfortunately, we don't have the same review that's happened here in the province. In fact, I've met with the previous chief medical examiner to ask the question, well, how many LGBT young people are taking their own lives each year in this province? And they don't actually ask those questions. They don't track the sexual orientation or the gender identity in child or youth deaths. And that in itself is a problem, where we don't actually have a sense of what the actual numbers are here in our own province. But what we do know from some of the research that's been happening, and in this case the Lancet, which is considered the world's premier medical authority or journal, came out with an editorial in 2014. And they stated that there is a mental health crisis amongst LGBT youth, and that specifically there were 2 key areas for intervention that needed to happen. The first was policy intervention. And we see particular kinds of examples where policy helps to set the tone and the direction. Policy enables resources to be able to flow to address these deficiencies or these differences or these inequitable outcomes. For example, we're having lots of debate in the province around Bill 10 and GSAs, and a call for legislative and policy intervention to help to provide young people to receive the supports that they need. Secondly, we see from the Lancet a call for schools to be primary intervention and prevention sites. Indeed, next to the family, many suggest that schools play perhaps the most important role in the lives of young people today. So imagine if you don't have support from your family because of your identity, and then you go to school and you find your school is a threatening or hostile space. What's left for you to turn to? Where are you left to be able to go to for support or outreach? Here in Canada, our Chief Public Health Officer has also issued similar statements. Here what we see is that sexual and gender minority youth, according to the Chief Public Health Officer, has said that experience higher rates of not only suicide, but harassment, victimization, physical or sexual violence. Importantly, both at school and in the community. So we're talking not just about work that needs to happen in schools, but also work that needs to happen in our communities with our frontline agencies. Whether you're looking at the Lancet study or our own Canadian studies, it's clear that LGBT young people face much higher risk than their heterosexual peers. We also know that for suicide in general, and for our LGBT youth in particular, this should be considered a major public health concern. How do we start to reduce those numbers? How do we come together with a comprehensive strategic plan for our province and indeed for our country to help to reduce that risk and build the resilience of our young people, regardless of how they identify. In fact, what the Lancet and the Chief Public Health Officer of Canada call for is a call to action. What we see, or the question that's asked, is how many more young people do we need to lose before we do something, before we start to pass the policies that matter, before we start to support interventions that make a positive difference, that help those young people move from risk to resilience. So for this presentation, I have an orienting statement. And this orienting statement suggests that sexual and gender minorities, or this LGBT community, in addition to having the same basic health needs as the general population, also experience significant health and healthcare disparities and have specific healthcare needs, mental health or physical, emotional, or otherwise, related directly to their sexual orientation and their gender identity. And you can see some of these as bullets on the slide. We know that there is greater psychological distress. But what we may not be as familiar with are the chronic healthcare issues and disease that begin to manifest. So for example, individuals in the LGBT community have higher blood pressure rates. They have more incidences of diabetes. They have more incidences of smoking, drug and alcohol use and abuse, and eating disorders. And importantly for our young people, this is often not because of their identities, but because of the environments they find themselves in. So these are all negative coping mechanisms or manifestation of being in stressful or non-supportive environments, and the toll that places on your emotional, physical, and mental well-being. What we know is that it's widely understood from medical research that a person's culture, their class, their religion, their ethnicity, and gender all impact how illness may be understood or manifest. Yet, healthcare providers, or youth workers, or mental health therapists seldom ask about sexual orientation and gender identity issues. As a result, key aspects of client care or healthcare service often go unaddressed. So what this really says is we're not getting to the root of the problem if we're not asking the right questions. We're not building inclusive environments where young people or families feel it's safe to talk about or disclose sexual orientation or gender identity issues. So this question is one that I'd like you to hold and keep with you as we go through the remainder of the presentation. So while access to medical care and treatment may be equal in Canada, the quality of that health care or service provided to sexual and gender minority persons often is not. So the question is why? If we believe that health care and access to mental health services is equal and available to everyone, why are there differential impacts? Why do many sexual and gender minority youth, families, or individuals feel that they can't access them, or that those services that are available in our communities do not reflect their needs or are not supportive of their identities? So what are some of the barriers? So the question that we're asking is, why is that? So sexual and gender minorities are more likely to face barriers in addressing or accessing appropriate medical care, which can exacerbate these health disparities. We know that heterosexual and gender normative biases exist. This is what we call the heterosexual presumption, that everyone is heterosexual unless proven otherwise. Otherwise, why would anyone ever need to come out if we just simply understood that there was a variety of sexual orientations and gender identities? It's often been said that heterosexism is like the air you breathe. You have to actually stop and think, oh, I'm breathing air right now. It's so predominant and it's actually invisible. So what we have to do is question, how do we help these invisible minorities become visible? Fear of stigmatization or re-victimization often prevents people from coming forward and reaching out for support. Is this healthcare provider, is this therapist, is this youth worker, is this teacher going to be supportive of my identity? Or are they going to further stigmatize or discriminate against me? We know also internalized homophobia and transphobia prevent young people in particular from accessing supports and services. This could be the fear of having their identity disclosed without their permission, being outed. This also has to deal with feelings of lower self-esteem. If you've never heard anything good about your identity, or you've never been told that you're accepted or you're valued or celebrated for who you are, this all has a toll on your self-esteem. And many individuals may feel that they're not deserving of care or treatment. If nobody loves them, then why should I care about myself? Or it's, I deserve to be sick because I've been told that I am sick or I am immoral. So we can see this devastating impact that this has on a young person's mental health and psychological well-being, where they may not even reach out for those supports because they're afraid or they're fearful or they feel that they don't deserve them. So our focus should be on harm reduction rather than on a moral-based approach to service or treatment. LGBT issues need to be understood and addressed as part of anyone's ethical, professional, and inclusive practice. So I've already thrown around all kinds of different terms and terminology, and I wanted to spend a few moments talking about some of these diverse identities. I often do this as an audience participation part, so if you're out there in Cyberland, you can play along. I joke that if you get the first 4 letters of this rainbow alphabet, we'll give you your bachelor's degree. If you get the middle ones, you get your master's, and if you get the final 4, you get your PhD. So I'll give you a moment just to think about what those letters stand for, what identities in the sexual and gender minority community they represent. So often you see LGBTQ used as a shorthand for these identities. Sometimes you'll see it with a little star representing that there are other identities that exist. So all of those identities stand for lesbian, gay, bisexual, transgender, transsexual, two-spirit, intersexual, queer, questioning, pansexual, asexual, and allied. So you see a variety of sexual orientations and gender identities represented under this constellation. So to try to pronounce that rainbow alphabet is almost impossible. And in fact, there'll be other letters added to that list as more people begin to define and expand how we understand our identities in society. So generally, you'll see us use the phrase sexual and gender minorities as an inclusive term. So the two that are used most interchangeably are LGBTQ and sexual and gender minorities. So when you hear those, whether it's those acronyms or that phrase, you know we're actually talking about this entire community that exists. So sexual and gender minorities, that is because the sexual part refers to sexual orientation, the gender part refers to gender identity and gender expression. So this community is also called an invisible minority because regardless of what people believe about stereotypes, you can't simply tell someone might belong to this community by looking at them, by listening to them, by judging the way that they address or their gender is expressed. So this is an invisible minority, and that notion between invisibility and visibility is often directly tied to how safe an individual feels or how welcoming they perceive an environment to be. We talk a lot about other invisible minorities in our society, such as some members of our various disability communities who you wouldn't know may have a disability or mental health or psychological challenges. They may not disclose that until they feel safe to do so as well. So creating that environment of safety is really paramount to any service, any kind of relationship we want to build, particularly with children, youth, and families. So we know that this community is also disproportionate targets for violence and victimization. We know that young people are often in a position of double jeopardy. They may want to come out to be able to access resources and services or supports, but at the same time they may feel it's not safe for them to do so. Will I be bullied? Will I be discriminated against? Will I suffer further violence or victimization if I am coming out, if I do make myself visible? So we also know that this community is coming out at younger and younger ages. So now the average coming out age for sexual orientation is about age 15. And that's the age of when a young person will come out and disclose to someone else, maybe a family member, a friend, a teacher. But the average age of self-awareness for sexual orientation is actually age 10. So we see a gap, a 5-year gap between maybe when a young person knows who they are and what their identity is, and still 5 years in those critical developmental years where they don't feel safe, comfortable, or confident to be able to share that with someone else. But that's changing too. I now know many proud, out, gay, lesbian, bisexual 10-year-olds and who know the words, who know the language. And it's just a matter of their reality. It's quite remarkable and amazing how quickly we're seeing this coming out age drop. Used to be maybe a decade ago that, oh, well, wait till you graduate high school and you go to that liberal university where you can find yourself, where you can be part of a community. But young people are no longer waiting. For gender identity, the ages are quite different, and they start quite a lot earlier. The average age at when a child has a sense of their gender is age 2. And when we start to see a discongruence between their biological self and their gender identity, often starts to manifest at around age 5 or 6. And that's where we're actually spending a lot of time these days, are working on gender identity issues in elementary schools with teachers, students, and families, rather than sexual orientation issues in high schools or even around issues of gay-straight alliances. So the landscape has shifted. The visibility has changed. What we see here is this new generation, which I call Generation Queer, which is part of the reason why these coming out ages have dropped so dramatically. A big reason is the internet is more positive representations in the media. We just have to look at shows like Ellen. And now many people say you're not a popular or hit sitcom or television show if you don't have an LGBTQ character. We can debate as to whether those representations are still positive or stereotypical portrayals or not. That's a conversation for another time. The other change has been family support. More and more young people are receiving support at earlier and earlier ages from their families. And in fact, their families are becoming their biggest allies. And their families are demanding that their schools, their doctors, community agencies are being receptive, responsive, and respectful of their sexual and gender minority children. In fact, what we see is that these children and youth and families refuse to be victims any longer. And when agencies or organizations are not supportive of these individuals, we see waves of human rights complaints happening all across the country, where these children, youth, and families are holding our public institutions accountable to provide, by law, non-discrimination environments on the basis of sexual orientation and gender identity. And they're winning almost every time. Here's an example from Edmonton and how this Generation Queer is growing in our schools and communities. This is a picture from our students in our Gay Straight Student Alliances, who were the Grand Marshals a couple of years ago of Edmonton's Pride Parade. Before Edmonton Public Schools had policy and became the first school board in Western Canada to pass a standalone sexual orientation and gender identity policy in 2011, they had 5 GSAs. And after they passed the policy today, they have over 25 GSAs, Gay Straight Alliances, at elementary, junior, and senior high school levels. So it's never too early to be talking about issues of safety, acceptance, and belonging, especially when they're being led by young people themselves. So a key factor for us to consider in improving mental health is this notion of positive identity integration. It's about having pride in self and pride in your community, knowing there's a community that you can belong to, that you can reach out to, that cares and supports you. And all of this leads to an enhanced sense of self and social esteem. So our focus in terms of improving mental health outcomes should be on reducing stigma and shame around individuals' identities, particularly for the sexual and gender minority community. So I've already talked about a whole bunch of terms that might be very new to people, talking about differences between sexual orientation, gender identity, gender expression, and our biological sex. This is a slide we use in a lot of our presentations, and I know they use in our Firefly in Schools program in our junior and senior high classrooms, which is a really simple and effective way to talk about these differences, or these four facets of identities that each and every one of us have. So a sexual orientation doesn't just belong to the LGBTQ or sexual and gender minority community. In fact, we all have a sexual orientation. Your sexual orientation is outward. It's who you are attracted to. The important things to remember about sexual orientation is it's not a choice. Somebody doesn't choose their sexual orientation, and that it cannot be changed without great harm to an individual. So rather than a focus on trying to fix, repair a person's sexual orientation, we should be focusing in on helping them to come to accept and hopefully celebrate who they are. Your gender identity. So your gender identity is inward. It's who you feel you are. Your gender expression is how you present that inner sense of gender outward to others. And you can see that all of these are on a spectrum. They're fluid. They're not either or choices. So your gender expression could be masculine, it could be feminine, it could be androgynous, and it could change from day to day or moment to moment as well. And then there's your biological sex, which is your physical sex, your hormones, your chromosomes. And you can see that's not even on a binary, although many people feel it's just male and female, XX and XY chromosomally. In fact, science has shown us that there are over 6 or 7 different chromosomal variations, yet we only have 2 categories in the West for gender, being male or female. And yet we have a whole variety. So you can actually plot yourself, and I encourage you to do so. Where would you fit on these 4 facets of identity? Where would you fit on these spectrums? So your sexual orientation, as a quick recap, is an individual's enduring sexual, psychological, emotional feelings of attraction towards another person. It's what operates on a continuum. So it's not fixed, it can change over time. Your gender identity. So your gender identity is that internal sense or feeling of being masculine or feminine. In fact, sex and gender are distinct and separate categories. So the example is we're all born with a sex, however, gender is assigned at birth. What's the first thing a doctor or a nurse will often say when a child is born? It's a girl or it's a boy. I think what parents want to know first off is that it's a healthy baby, right? But from that moment, the gender of that child has been assigned based on nothing else but their physical sex. And it's often said that that gender has been assigned and will be regulated for the rest of that child's life into what it means in our society to be a boy or a man or a girl or a woman. And if you step outside of that, what many young people call the gender box, that's when the bullying takes place. Oh, boys can't do that. Girls shouldn't do that. It's very interesting in our society how we can have a tomboy, for example, daddy's little girl being rough and tumble until about the time of puberty. And then it's time to put on the dress. And if you don't, and you resist that gender box or that characterization, then it's that language of homophobia that starts to come in and sexism, where that person's considered to be a lesbian or a dyke because they're transgressing those gender norms or those stereotypical roles based on nothing more than their appearance or their performance of their gender. So it's interesting how you can have a tomboy as a girl, but you can never have a sissy boy. You can never have a boy that shows femininity because it's assigned with weakness And so the question is, why is that? And I would say to every woman out in our audience, why do we allow that to happen? Why do we devalue femininity over masculinity, particularly when it comes to our young people and our children? So there's much more we could actually say. In fact, these few slides are about a Gender Theory 101, 39-hour university course in about 2 or 3 minutes. But the important thing here is to remember that our gender identity and gender variance exists on a continuum. We see gender is a social construct. In fact, gender is performed differently all over the world. 2 men holding hands walking down White Avenue here in Edmonton or downtown Calgary probably will not feel safe to do so. But 2 men holding hands in places in Europe or even in the Middle East has a completely different connotation. I love how one young person put it the best when asked about their gender identity. They said, I put it all in a blender and mix it up. I'm a gender smoothie. And it's young people today who are embracing this fluidity of sexual orientation and gender identity unlike any other previous generations. In fact, you go to Facebook nowadays, and there's not just 2 gender choices for your profile, there's over 50 gender choices. So this is the reality of our youth generation. So when we talk about, for the next part of the presentation, talking about, again, what are some of these barriers to inclusive service or practice? So when we talk about the helping professions, we often think about our medical community. A survey came out in 2007 of over 700 Californian physicians that found, surprisingly, that 18% were sometimes or often uncomfortable in providing basic care to gay or LGBT patients. So what we see here from this survey, one of many, is the importance of us challenging and changing attitudes of our frontline service providers, whether that's our medical doctors or our counselors or our therapists. These are the helping professions that are designed to do no harm, but the question is, what harm are they actually doing by holding prejudicial, stereotypical, or discriminatory attitudes? And when we look at what this demonstrates the need for, not only to reflect on our own personal biases and to examine barriers to inclusive and comprehensive care, us becoming self-reflective practitioners, but also thinking about training. What training are we providing in our medical programs, in our social work programs, in our counseling or education programs? Yesterday was the first day of classes at our university, and I was able to launch a brand new course in our Faculty of Education, first time ever offered during our regular term, on sexual and gender minorities in education and culture, where we're working with pre-service teachers even before they step into the classroom for those 39 hours and helping them to understand the research and how to become that teacher who is there for every student who walks into their classroom. So we issued the challenge to other programs, particularly our pre-professional programs, to be providing the same kind of comprehensive education in our undergraduate and our graduate education programs. So our role should be to educate and treat, not to judge people. That's so important. So we see that training in communication skills is vital, actually being able to know what that rainbow alphabet means and being able to be comfortable and confident using the terms. If you're not comfortable actually saying the words, how do you expect to be able to have a conversation, whether it's in your classroom or whether it's with your various clients? So how do we talk about LGBTQ issues? How do we challenge those stereotypes? How do we change this heterosexual presumption? How do we address homophobia and transphobia? So when we're working with particular groups of young people, particularly some individuals from our ethno-cultural minority communities, or in the example before you in our Aboriginal communities, we have to understand this concept of minority stress. So you see in the outer circle all of these different kinds of isms: sexism, heterosexism, racism, white privilege, colonization, homophobia, poverty, ableism, classism, transphobia, that all exist in our mainstream culture. And these are often the dominant messages that are given to our minority communities, that you're not one of us, you don't belong, and how those then tend to get internalized, particularly by our young people, you see in the middle circle. So now imagine if you're, let's say, an Aboriginal youth, and you want to come out in your Aboriginal community. In an Aboriginal community that's dealing with the effects of colonization and institutionalized religion that hasn't been supportive of sexual and gender minorities. So you're not sure if you come out in your Aboriginal community if you're going to find support for your LGBT identity. And then you go to your LGBT community, if you're lucky enough to find one, where you reside, and you find out that they're just as racist as the mainstream community. And so where you thought you'd find support for your sexual orientation and gender identity, you might find in the LGBT community, but you may not find support for being Aboriginal. And so what happens is these young people get caught between life worlds without any support. So we see how they have to navigate three distinct kinds of culture: mainstream culture, their own ethno-cultural background or culture, and then the LGBT community itself. And so they have to often prioritize or suppress different aspects of their identity to find acceptance. So I get acceptance for my Aboriginal identity in my Aboriginal community, but not my LGBT identity. And I go to the LGBT community, I get acceptance for my LGBT identity, but not my Aboriginal identity. And then I don't get any acceptance from either from the mainstream culture. So imagine the tremendous psychic energy it takes to manage and negotiate and navigate all these various facets of your identity. Where is it safe for me to be visible? Where is it not safe? Who can I tell? What aspects can I reveal? What aspects do I have to hide? So we see that they can be what's considered to be minorities within a minority. And now you can layer on and have not only a triple minority, but a quadruple minority or more. Put someone with a disability, a learning impairment on top of those identities as well. So what we see here is our need to expand resources, particularly to LGBT youth in our ethnocultural communities, in our First Nations, Métis and Inuit communities, and in our religious and faith-based communities. In fact, LGBT youth in those three communities are often some of the most at risk for some of the most severe negative health, safety, and mental health outcomes, simply because there are very few resources and supports. And then those get compounded even more so if you're in a rural or remote community where these issues simply don't exist or are not talked about at all. So we often get a lot of questions around two-spirit identities. So I briefly just wanted to mention that because that's one of the priority communities we should be working with, particularly here in Alberta. We know that prior to colonization, two-spirited identities were often held in high regard. In fact, there are many Indigenous communities that have 6 or 7 different names for gender. But along comes colonization and we see this Western framework of only male or female. We know that two-spirited, those who are considered to hold both the masculine and the feminine in one body, were often given special roles and recognition in their communities because they were in touch with both. They were often medicine people. They were often also considered to be what we would consider today to be a modern social worker. So if a heterosexual family was having problems raising their children in some Indigenous communities, they would in fact take those children and give them to the two-spirited person to raise. So these traditional teachings and learnings are now beginning to be voiced once again after the impact of institutionalized religion, colonization. What we start to see are new resources that are being developed. For example, the Society for Safe and Caring Schools and Communities has a fantastic resource on two-spirited youth for educators to begin to better understand these needs and issues. So, what does all of this mean in terms of health, mental health, and safety consequences for LGBT young people? These are the risk factors that are well documented with over 10 years of research. Often I don't put these in my presentations because we get tired of talking about LGBT youth as always being at risk, as always being vulnerable. But I realize that if I don't put these in the presentations, there are many people who don't understand the severity of the problem that we have. And this isn't just one study, but these are studies, current and past, control group studies that compare LGBT youth to their heterosexual peers. The research is clear, the research is conclusive and without debate. We know that these young people are more likely, when compared to their heterosexual peers, to be truant or drop out of school. You know, and that's intuitive. If school is not a safe place for me, why would I be there? High school completion rates are a huge priority in the province of Alberta, and we know that LGBT youth are less likely to complete high school. Well, why don't we have any programs targeting and supporting them to complete high school? In fact, a recent study just released this fall from the Toronto District School Board, which is one of the largest school boards in North America, did a survey with over 250,000 students, and they asked questions from grade 9 to 12 on sexual orientation and gender identity. And they found that 68% of LGBT students were less, 68% of LGBT students completed high school, compared to 78% of heterosexual students who completed high school. So we see a 10% differential gap. And then when we ask the question about are you likely to attend a post-secondary environment, the rates even dropped further. Just 50% of LGBT youth felt that they could go on to post-secondary education. And the number was much higher in the 70 percentile ratio for heterosexual youth. So the next item talks about drug and alcohol abuse. LGBT youth are 2 to 3 times more likely to abuse drugs and alcohol than their heterosexual peers. This is what's often been called self-medication, right? If I can just dull the pain, I don't have to think about it, I don't have to feel it. We know increased rates of peer victimization. So from that same Toronto District School Board study, 27% of LGBT youth had received threats of violence in their school, compared to only 13% of their heterosexual peers. We know that these young people are more likely to withdraw from school and social activities. It's this isolation and alienation that happens. They withdraw or they're pushed out. They're not accepted in their peer groups. We know that they're also more likely to have experiences of dating violence. And this is because of a lack of relationship role models, where they don't get to see healthy, loving LGBT couples presented in our media or in our society, but also because of that internalized homophobia or transphobia. If you've never heard anything good about your identity and then you get into an abusive relationship, well, many young people feel that this is what I deserve. Because this is what society has told me what I'm worth. Or they're afraid to leave those abusive relationships because their partner may threaten to out them to family members or at work or in the community, and that can place them at significant risk as well. We know that paradoxically, LGBT youth have higher rates of pregnancy or parental involvement. And this speaks largely to the fact that we don't have comprehensive sexual health education in the province of Alberta. In fact, nowhere in the provincial curriculum is sexual orientation or gender identity even mentioned in any curricular outcome from kindergarten to grade 12. In fact, many believe that to be a human rights violation, where you've written an entire class of youth out of your textbooks, out of your classroom, out of your curriculum. If you don't learn about your identities, you learn through the silence that your identities don't have value, or you don't have hope for your own future. But also, one of the reasons for higher pregnancy rates are there's no greater way to prove, quote unquote, one's heterosexuality than to have a child. So particularly for youth in our LGBT ethnocultural communities, the value placed on family is one of the highest cultural values. And so having a family gains you a child immediate acceptance and support in your cultural community. So there are many concerns. We also know that there is a significantly higher rates of bullying, physical assault, violence, harassment, and sexual abuse. From that Toronto District School Board study showed that 19% of LGBT youth reported cyberbullying, compared to only 8% of heterosexual youth. On every measure on bullying from that Toronto District School Board study of over 7 categories, LGBT students fared worse than their heterosexual peers. We also know that LGBT youth are more likely to be street involved or homeless or run away from home. This infographic really speaks to the issue, and it says that in Canada, in the top left corner, there are between estimates of 65,000 and 150,000 homeless youth in Canada. In Toronto, as an example, on any given night, there are between 1,500 and 2,000 homeless youth. And in Toronto, there are only 13 shelters with a capacity of 529 beds. So if you have 2,000 youth who are homeless and only 529 beds to house them, you can see that we have a huge problem in our social services. The research shows us that between 25 to 40% of all homeless youth identify as LGBT youth. So this has often been our throwaway kids who families don't support them, and then you go to school and school is not supportive. Well, too often you end up on the street simply trying to find a place to survive. In Toronto shelter system, this is in the official system, 20% of the homeless youth in the system identified as LGBTQ youth. We know that that's probably a dramatic underrepresentation because many young people won't identify themselves because we talked about issues of safety, and that's only the youth in the system. Never mind the 75% of those homeless youth that can't even get into a shelter system or get a bed on any given night. So the number one cause of homelessness and the number one cause for LGBT youth was family conflict. So this really speaks to the importance of us not only working with LGBT young people and children, but how important it is to also work with their families. We have a project called the Family Resilience Project, which is funded in part by Human Services and our Edmonton region and the United Way and the City of Edmonton, that we call the Family Resilience Project, where we provide free short-term counseling for children, youth, and families on issues of sexual orientation and gender identity. We wanted to remove the barriers of cost, number one, and then number two, of actually finding a counselor who was knowledgeable, who had training, and also who was not going to further re-victimize or discriminate or be prejudiced against these young people or their families. And so we have a waiting list for service of over 5 to 6 months. That's the level of demand that exists. And our goal through the Family Resilience Project is to help those families move from rejecting behaviors to learn how to accept their LGBT children and hopefully get to the point where they can move to celebrate them for the gifts that they are. But it very much is a process that sometimes needs not only professional support, but peer support, learning and engaging with other families who've gone through a similar process. So when we go back to the risk factors, we see that LGBT youth are more likely to turn to prostitution or living on the streets to survive. We know that they're more likely to suffer from chronic stress, which we talked about, and manifests itself in health and mental health issues like depression, post-traumatic stress syndrome, and increasingly what we see is self-harming behaviors. And perhaps the most sad or damning statistic is the fact that LGBT youth are 2 to 3 times more likely to take their own lives than their heterosexual peers. Suicide is one of the leading causes of death of LGBT young people. It's not the leading cause of death of our heterosexual youth. So, as a summary of some of the things that we've talked about, particularly as it speaks to impacts of mental health, we have 3 key domains. So we have the mental, emotional, and physical health and the negative outcomes we've talked about. We also have how homophobia, transphobia, and heterosexism impact the personal or the individual, whether that's through physical violence, verbal harassment, cyberbullying, or simply being rejected from your peers or your communities. And then we have the environmental factors. So this is the culture. This is the lack of role models, the lack of policy, familial rejection, physical attacks, street involvement, the lack of being able to access inclusive healthcare information or service. So ultimately, our goal is to help youth move from internalizing these negative outcomes, where they often feel alone or isolated, to reaching out or externalizing to get help and support. We work with thousands of youth, and the number one message that we send these young people is that no issue too small, no issue too big, but if we don't know about it, we can't help you. And so that means building those trusting relationships, right? That means having a supportive adult in your life as a young person. We call this the power of one, of any young person having at least one trusted adult in their life that they can reach out to and they can turn to for support. And again, that moves away from that internalizing, feeling like I have to deal with this all on my own, or there's no support, or if I reach out, am I going to be safe, to externalizing and finding that trusted adult. Hopefully, young people will have many trusted adults in their lives. And we know for the LGBT community, we can't always count on their families to be those trusting adults. And that's a huge difference for this community than many other communities of young people. Often, if you're a youth who comes from a racialized community, if you deal with racism at school or in the community, you can often turn to your family and they can help you positively reframe that or get through it and say, oh, I experienced that. Here's how I dealt with that. And you can find support. But for many of these young people who are dealing with homophobia, transphobia, or heterosexist or non-supportive environments, they can't turn to their families. Their families may be their biggest threat, or simply don't know what to do. Many families send their kids to our Camp Firefly program and say, you can give our child what we can't. You know, we're a heterosexual family. We don't have this lived experience, but we know it's so important for our child to be able to find peers like themselves in a safe, supportive, non-judgmental environment. In fact, here's a picture from one of the young people who came to Camp Firefly. We're an arts-based camp, and we find that sometimes young people can say so much more through the arts than they can ever say through words. I want to give you a moment to look at this slide and look at this picture and see if you can come up with a name for it, a title. Anybody have a guess? So this young person called it The Secret. And you can see it's actually portrays the phases of self-identity and awareness and for many, the coming out process. So you see in the top left a child walking along, you know, on a journey, on the journey of life. You see them looking within, being introspective, learning something about themselves. You see the red ball that they're holding, that core essence of who they are. You see immediately that they learn they have to protect it. They have to hide it. They have to keep it away from others. And then you can see in the lower left corner the bullying and the taunting that begins to occur when somebody perceives you as being different. And then you can see what happens when you're able to have open conversation, when you're able to talk meaningfully and engage about that difference, not as something to be feared or attacked, but as something to be acknowledged, respected. And then in the last corner, the right corner, you see what happens when that difference or that diversity is celebrated. When you find community, you find peers, you find that community of support, or you find that family that is going to accept and embrace you. I think an incredibly powerful and moving representation of the journey of so many young people are engaging with in our society. And this particular drawing came from a 15-year-old youth who moved to Canada from Iran. Family settled in Regina. The child came out, spoke very little English, came out, was immediately thrown out living on the streets. It was the church pastor who found him, heard about Camp Firefly, called, put him on a bus, bought a bus ticket, and sent him to camp. And for 4 days, we were communicating largely through art around his experiences. And he said, through very broken English, this is why I came to Canada, so I could be free. Because in his own home country, he would be killed for his sexual orientation. And then he said, I'm not going back. He didn't want to go back on the bus, back to Regina, because he came to Camp Firefly, and he said, this is the community I want to belong to. And we had to tell him that this community does not exist. For 4 days, we create a world free from fear and abuse. For 4 days, we create a world that does not yet exist. And the last session we have to do at camp is called Camp's Over, Now What? How do we go back knowing that you may be going to a community without support, or a family that doesn't acknowledge or value, or a hostile school environment? But what they do know when they go back after camp is that they're no longer alone. There is a safe place that they can continue to reach out to. We don't call them alumni, we call them alumfly. And the notion is whether you've attended camp one time or many times, or whether you're like Kiana and you've taken those leadership skills you've learned at camp or through your GSA involvement, you're paying it forward. You're making a difference for other young people. You're helping to be part of the change that our society needs to see. So when we talk about the impacts of these negative outcomes or coping mechanisms, or the pressures of having to hide your identity, the youth say it the best. At the camp, we learn from the young people. We do research. The policies that we advocate for are all coming from these direct experiences of young people. That's my job. That's the privilege that I have, is helping to amplify these voices of our young people, to help them move from being at risk to being resilient. And that's why we hold our policymakers accountable. That's why we hold our MLAs to the highest standard, to say, hey, don't forget, these kids are our citizens too. You represent them. You need to ensure that our policies and our laws and our services are all inclusive of their needs as well as everyone else's. But the impacts from the young people themselves, when you have to hide who you are, it makes me even more angry. And since I can't express that anger, it turns inward. It requires energy that should be available for other things, like learning, growing, being a child, being happy, play. It can crush people on the inside. You eventually fade as a person. It changes you. It rots you. Right? That's the devastating impact of that internalized homophobia and transphobia. I think it absolutely kills my self-esteem and confidence, right? When we talk about high school completion, we talk about going to post-secondary, we talk about dreams and hopes for your future, right? If you don't feel that you have any hope, you don't see that you have any future. It's emotionally draining to always pretend that I'm someone I'm not. So these are those devastating impacts that can play a toll on a young person's mental health and well-being. So what can we do? So I'm going to conclude with some takeaways. So the first and probably one of the most important things is to create an inclusive environment. It's say those words. Say the words from that rainbow acronym, that community. Say LGBTQ. Bring visibility. The first thing I do whenever I walk into a school or an office is I stop at the front door and I stand there for about 30 seconds and I say, what is this office, what is this school communicating to me? What do I see on the walls? What do I hear in the hallways? What do I hear at the front desk? Do I see myself included the moment I walk in through those doors? Remembering that this is an invisible minority, and if you don't signal your support, they're going to question whether the support is actually there or not. Challenge that heterosexual bias or presumption from the front desk to the treatment room, or from the front door into the classroom. Remember that at least 10% of your population is going to identify as being non-heterosexual. Provide universal and gender-inclusive restrooms. This is really important for our trans youth, and washrooms are often a source of violence for many young people. In fact, a gender inclusive or an all-gender washroom should be part of universal design and access. The same way we have now many family washrooms, or we have disabled washrooms. They're part of our building codes. Why don't we have in Alberta, as part of our building codes, universal all-gender washrooms in every building that is built? Certainly a huge issue we're dealing with in schools. And I'll give you an example that happened on the weekend. One of our alum fly, a trans youth who came to our program, was in a local mall and went to use the family washroom, and the mall security refused. And they had to disclose that they were transgender, and they still refused this young person's basic human right to be able to use the bathroom because they didn't feel safe being able to go into the traditionally gendered bathrooms. So thankfully, that young person reached out and said this was unacceptable and came to us. And so later today, I will be meeting with the head of the mall security to talk about the issue and to talk about the training, talk about the policies that they should have in place, and ask for an apology to that young person to ensure that that never happens to anyone else again. So it's all part of that education and social change piece that needs to happen. But examine your surroundings. My personal physician, my doctor, I have this great thing about, if you know, you hate waiting in the doctor's lobby office for your appointment. So she keeps me waiting a very short amount of time, because the longer I wait in the office, the more I tell her as I go through her magazines and look at the images on her walls to say, well, I don't really see my identity reflected here. Why don't you have magazines in your waiting room that simply reflect the LGBT community alongside every other community? It's such a simple and easy way to break that silence, to provide visibility to those invisible minorities. So when she knows I'm in the waiting room now, I get rushed right in, because otherwise we're going to have she's going to be educating me and I'm going to be educating her about, you know, inclusive service and practice. So it's a win-win. But also having clearly identified non-discrimination statements posted at your front desk to signal to patients or clients or in your school or in your student agenda that discrimination on the basis of sexual orientation or gender identity, along with other forms of discrimination, are not acceptable. Naming these issues matters. Policy matters. Visibility matters. When you have visibility, you have inclusion. A young person says, my identity has value, it's recognized. When you have silence, the default is exclusion. And it's questioning, am I safe? Am I included? So let's remove the uncertainty. Here's a great poster that we're working to have updated that should be up in every counselor's office. Every person who works with a young person or a child should have a poster like this up. It just says, I'm willing to talk about any of these issues. And I've had young people who will not even be able to say the words, but will come to the poster and put their finger on the word, because it could even be too dangerous for them to say those words out loud. But what we've done is we've broken the silence, we've opened the conversation to say, I'm prepared to talk about these issues with you. I'm not going to judge you, I'm going to support you, and we're going to get through this together. Here's another great poster from the Alberta Teachers Association and their Safe Spaces initiative. And all of the images on there are from a youth who created a quilt with representations of their identity from the LGBT community. And so importantly, there are three key messages: that when we talk about sexual orientation and gender identity in schools, we're talking about a human rights issue. Importantly, we're talking about respecting individuals for who they are, not for whom we think they should be. And thirdly, that addressing homophobia, transphobia, and heterosexism is everyone's responsibility to create a safe, caring, and inclusive environment. So you can actually go to the Alberta Teachers Association website, and you can click on these images, and you can hear and read the stories from the young people about what these images mean to them. The top image is called The Faces of Inclusion. The one with the rainbow and the heart shows that love regardless of identity or gender. The one on the AIDS ribbon being torn and tattered at the bottom shows that issues of sexual health are largely forgotten about or ignored in our schools. And the interlocking gender symbols show that any combination of identity is okay. And the last one at the bottom of the two young women holding hands was shouting out their love for one another in the dark, cold, unaccepting night or world. Powerful, powerful statements of young people who are expressing their identity and who are wanting adults to be there to care for them, to provide for them, to help them feel safe and welcomed wherever they may find them. So another quick question you can ask yourself is, do you have a referral network? Do you know where, if somebody is asking for specific support on issues of sexual orientation and gender identity, where to refer them? What are those positive, supportive referrals? Because if a young person gets a referral and they go to that provider and they're not comfortable, they're not accepting, or they're not open, they're never going to go back. And they may never go back to another counselor, another teacher, another physician again for the rest of their life because of that experience. We can't expect young people to keep knocking on doors until they find support. They should get support the first time that door opens. And importantly to remember, for this community, it's families of choice, not necessarily families of biology. This is especially important in urgent or emergency or inpatient care settings. Often you see the sign that says immediate family only, right? But for this case, an individual, and particularly a young person's biggest source of support may not be their biological family. It may be their friends. We should be asking them who are their personal or moral support networks. And those people should be the ones that we're allowing to come in and help to work and support them. Acknowledge and mark significant days in your organization, your institution to take part in. Particularly, we have one coming up at the end of February, Pink Shirt Day, which we've launched in the province in partnership with the Alberta government, the Society for Safe and Caring Schools, and our Institute for Sexual Minority Studies and Services at the University of Alberta. And I'm proud as well to announce one of our Camp Firefly partners, ATB Financial, is also partnering this year with us on Pink Shirt Day across the province. So this is an easy way that your organization can begin to break the silence, open conversation on this day, to have everyone wear pink shirts, to stand up against bullying, and to stand up against homophobia and transphobia. The last little things are ensure that your forms are inclusive, whether they're intake forms or your school forms or even your community forms. What options for identification are you providing? Instead of just male, female, what about male, female, transgender, and other? Right? We give people the right to self-identify. And you may be surprised to learn how people identify. Utilize open-ended questions when you're talking to people. Don't make those heterosexual assumptions. Don't say, well, assume boyfriend or girlfriend. Ask about partner or spouse. Allow, again, it shows simple things that allow people the option to identify. Ensure for non-judgmental and professional approach to service by all staff. When we talk about zero tolerance for discrimination, particularly from staff members, has to be a standard that we're striving towards. We need to clearly communicate what professional behavior is expected in our institutions. Use gender-neutral language. This is important as well. So we talk about significant other or spouse, but when asking a question, rather than said with a young person or a child, tell me about your boyfriend or girlfriend, how about tell me about the significant relationships in your life? Far more inclusive, right? Instead of if a young person from the LGBT community says, or it's a young lesbian and the service provider says, tell me about your boyfriend, well, conversation stops right there. You may never even get to a second question because this person will just shut down and say, this person doesn't know me, they're not supportive, I'm not going to say another word. So your language does matter. Model back the language that youth use. Don't label young people. If they're using a word, ask them why they're using that word. What we need to do is normalize discussions of sexuality and gender. We need to think about what would it mean for us instead of making these conversations extraordinary that we're having with our young people or in our agencies or communities, and instead they were ordinary. They were part of everyday conversation that we were having. That's the goal, is to make this part of the everyday, ordinary conversations we have with children, youth, and families that we work with. Be open and willing to let your patients educate you. So one thing you can ask your clients, if you're working with young people directly, is say, do you have any sexual orientation or gender identity concerns? Say the words, ask the question. If they don't, they're going to say no, and you're going to move on to the next question. Or say a simple question like, are you comfortable with your gender? Well, if they are, they're going to move on. But if they're not, you've created an opening. You've now created to say that, you're willing to have that conversation, right? If you don't ask those questions, those issues may never come up because of that default presumption that exists so strongly. Confidentiality is a big one. So privacy and confidentiality are major concerns for young people. There's a fear of disclosure that if they share their sexual orientation or gender identity with you, what are you going to do with that information? Are you going to go run and tell their parents? And you should absolutely never tell anyone or their parents without their express consent of the young person. I remember a police officer who told me, well, I would want the teacher to tell me immediately if my son or daughter disclosed that they were lesbian or gay or bisexual. And the police officer says, if a student came to me and told me that, I would call their parents immediately. And my response is, no, you won't. In fact, you do that, you may lose your job over that, because it's not your right to disclose that information without their permission. In fact, you can place them in great harm by doing so. Well, the police officer said to me, well, I would want to know as a parent. And then my question was, well, why don't you know as a parent? This is about the conversations and the quality of relationship you're having with your child, right? Not something that somebody else should be sharing with you or needs to share with you. So we really need to think carefully about that, because some youth may never come out to you if they're afraid of what's going to happen with that information. We know we should also conduct violence screening. It becomes very important, because sexual and gender minorities are one of the 3 most targeted groups for hate crimes in Canada. And of all the hate crimes committed, they're the most violent in nature. We're not talking about 1 stab wound, but we're talking about 40 stab wounds, where these individuals are not even seen as persons, but as objects to be destroyed. That's the impact of homophobia. That's the impact of transphobia in our society. Much higher rates of not only violence, but sexual assault and sexual exploitation. Language. Using open and inclusive language. If in doubt, ask for clarification. Use preferred pronouns and names. Ask people how they want to be identified. And make sure you reference that. So if you're working with a transgender youth, ensure you're using the name that they prefer. Ensure you're using the pronouns that they prefer. In fact, if you don't continue, or you misgender, you misidentify, or you deliberately misuse their pronouns, that is a form of professional misconduct or malpractice. It's unethical and it's unacceptable. Remember, we need to accept youth for who they are and where they are. It's not our role to label or to judge or to name them. Staff sensitivity and training is important, and I think what we're trying to do through these mental health series is the importance of professional development, of frontline training. Edmonton Public Schools, as part of their sexual orientation and gender identity policy, in all 200 schools, they've identified 1 staff member to be a safe contact on sexual orientation and gender identity issues. And that safe contact is then trained, given a half-day professional development training, becomes part of a safe contact network in the school district, and that safe contact is communicated to students, to parents, and the entire school community, so that they know that there is a direct point of contact. There is an ally in that school that is willing to have those open conversations with them. So think about that in your agency. Do you have a safe contact identified? And what kind of training is being provided to ensure that your agency workers or your members, your employees, are comfortable with the language and the knowledge and actually have an opportunity to dialogue and say the words and learn about these issues. So I think I'm going to leave it there, and my last slide is just a quick recap of what we can do. So Engage in professional development and reflection. Look for those opportunities, not only formal but informal. I would encourage all of you to get out to one of the Pride festivals. There's so many events that are happening. Get to know your community. Be a part of your community. You don't have to be an LGBTQ person to become an ally, to stand up for the human and civil rights of a vulnerable population in our society. Use inclusive language. Think about your words. Normalize sexual and gender realities. Make these conversations ordinary rather than extraordinary. Display those affirming symbols and images. Break the silence. Show through your words, your actions, your images that you are inclusive. Establish safe and therapeutic or educational spaces. So whether that's specialized programs or services or building general capacity across your organization. Advocate in these issues. Take part in events, things like Pink Shirt Day. Be familiar with LGBT resources that exist. They're growing by the day. In fact, you can go to our Institute website and we have the resources broken down for youth, families, and educators. And what we do is we take the very best resources we can find from agencies, including the Alberta governments and others, and we put them up as PDFs on our website, so you have a one-stop shop where you can go to find resources and support. And lastly, educate yourself, read a book, ask questions, talk to your friends. You'll find that if you break the silence, you may be surprised to know how many people around you are part of the LGBT community or who will begin to identify themselves as allies. The statistics show that 1 in 10 people might be part of the LGBT community, but 6 in 10 people, or 60%, have a direct investment, might have a family member, a friend, a coworker. So when you break the silence, you create opportunity for a community to come together, to give voice, and to support some of our most vulnerable citizens, especially our youth in our society. The remaining slides have examples of some of the resources. I encourage you to look at them or go to our go to our website to explore further. And always feel free to contact myself, or we have many staff members now at our institute at our institute who are willing to provide training or come out and help to support you to develop your own ethical, inclusive, and just practice. Thank you very much.
So I'm going to start with a couple of questions from the webcast, and we had a very active discussion going on the webcast. The first question is, what sectors do you think are critical to address when increasing cultural competency around LGBTQ issues? You mentioned health and education. Are there any others?
Absolutely. We work extensively with police as well. And proud to say that the Edmonton Police Service we've worked with over a decade has come a long way of not only having out police officers all along the LGBT spectrum, but at some of their highest levels, including deputy police chief. In fact, the deputy commissioner of the RCMP is an out lesbian. But that means that we have people in positions of leadership, but we also have to build the capacity of the organization. So leadership is important, but doing the work and the resources is equally as important. Also in our corrections facility, I can tell you every couple of weeks I'm getting emails, phone calls from whether it's correction workers or individuals who are incarcerated themselves who are on the spectrum that find unsafe environments in our corrections facilities and systems. So policing, corrections, for sure. But most importantly, our faith communities is where we need to do a tremendous amount of work. And we need, quite frankly, our government to step up and to help lead that work in those communities. We need strong and brave leaders within those faith communities also to step up and help to lead conversation. These are not easy conversations. They're difficult conversations, but they're conversations we must have. You may have seen, certainly in the United States, the recent news of the transgender youth who took their own life because they failed to receive support from their Christian family. And that's a travesty and a tragedy that should never be repeated. And it really speaks to the importance not only of family, but the role of faith and religion should never be a weapon, but should be a positive source of welcoming and affirming support. Your sexual orientation and gender identity are not disconnected from one's faith. In fact, at Camp Firefly, we talk a lot about how to positively incorporate your faith, your sexuality, and your gender together. They don't have to be mutually exclusive.
So here's a hot button question. What do you suggest if a staff member of a community agency or school is Muslim, Jewish, Catholic, Christian, Jehovah's Witness, Mormon, Seventh-day Adventist, and they believe that using a youth's preferred pronoun violates their core beliefs?
Well, it's particularly in a school environment, it's a public institution. It's separating the personal from the professional. If you can't separate the two, then one would question whether you're in the right profession. We tell teachers, regardless of how they identify, your job is to, do no harm. It's to welcome every young person into your classroom. If you were so adamantly personally opposed, you should never turn your back on a child or youth in need. Your baseline responsibility is to connect them with somebody who can help to support them, not to condemn, not to turn your back away from them. But ultimately, it starts with education, right? It starts with working with where those individuals are, getting them to understand what the expectations of the organization is, what does the law actually say about what we're required to do, and if you can't meet that, then the hard decisions come where you have to say, maybe you need to find another job, maybe you need to find another career. We say the same thing in schools where some families are adamantly opposed to addressing these issues, and a strong principal will say, well, we're not going to change the values of our school community. Perhaps you'd like to find another community that is more suitable to your values. Right? The onus is not, the problem is never on those LGBT youth or children themselves. The problem is in the attitudes and the environments.
Am I allowed to say great answer? Great answer. So I have someone who's a mental health clinician and then someone who's identified, they've come out, and so they've said from both of their roles, how can we support a young person or any age coming out? So from the mental health clinician perspective and the person who's also LGBTQ identified.
And it's important for us as organizations to create the space and the safety and the climate where individuals within those organizations actually can come out as LGBT individuals. Because we do a lot of work with corporations around this who are now creating affinity groups, employee groups. In fact, every major corporation now probably has a vice president of diversity, because you know what happens when people can't bring themselves to work? They leave. And we talk about employee retention and recruitment, huge issues right now, and how costly it is to replace somebody who's actually left, and bringing out the very best of an individual in a workplace environment. So I think it's important that those individuals are supported to come out and bring that to their jobs. But also, we shouldn't then just expect the LGBT individuals in our organizations to do all the LGBT work, right? It's that ghettoization that happens. Or it says, or you're the Muslim person, so only you deal with Muslim clients, right? No, it's important to start there, but we want to build capacity across our organization so that everyone feels comfortable and knowledgeable to be able to support particularly our children and youth regardless of how they identify. Certainly there's times where there's specialization that needs to happen. Now for the mental health clinician, I think it's really important then we do that professional development. If we haven't got that training in our graduate or undergraduate programs, then we need to get out there and do that training on our own. Set your professional growth plans, incorporate this, get support from your supervisors to bring people in, or go to training events that exist, or these kinds of webinars. And I'll mention that an important professional development opportunity coming up here in Edmonton. We're bringing in a speaker to talk about LGBT youth homelessness, and that's going to happen in March during the University of Alberta Pride Week, and we have space, I think, for up to 100 service providers to be able to come and hear directly from an expert on LGBT youth and homelessness and street involvements. And that's in partnership with Homeward Trust, Reach Edmonton, and YES, our Youth Empowerment Supports and Services organization, who have all come together to not only help to educate their own staff members, but the broader service providers out here in Edmonton and elsewhere.
Are there any questions here in the room before I go to another one from the web? So SM is a clinical psychologist in Newfoundland, and they would like to know, how do we combat systemic discrimination more so than systematic? For example, boys and girls athletic teams.
Hello, Newfoundland. Thanks for joining us. Yeah, absolutely. And policy is a big thing to get at the systemic issues. We're talking about not only policy, but attitudinal and cultural change. So when I work with, I'll give you the example of elementary educators, I often say the question I want you to always ask is, when does gender matter? And if you're asking this question, chances are you're going to be thoughtful in what you're doing in your classroom, your environment. So instead of boys line up over there, girls line up over there, where we're creating these artificial distinctions, who likes ice cream? Who likes popsicles? Who likes cupcakes? Who likes, cake? And you can be creative in the way that you're dividing up your classroom, because what happens is, particularly that trans youth who gets caught in the middle, right? They go over to the boys and the boys push them away and say, you're not one of us. They go over to the girls and say, you're not one of us. And what it does is it just keeps that binary of male and female and nothing in between. Instead of that spectrum where there's those spaces to identify all the way along. Right, and those can change. So when does gender matter? We're not saying to desegregate some all-girls schools or programs, some that can have merit behind them, but ask those kinds of questions. And what conversations are you having? Are you opening up spaces of possibility and inclusion and for identity, or are you closing them down? So sports teams are, again, rather than basing sports teams on gender, why aren't we basing them on skill? Right? What subtle messages? So we're working, for example, with many organizations. I sit on a national committee for the Canadian Centre of Sports and Ethics, and we're developing a transgender policy for amateur sports in Canada, all the way down from short of the International Olympic Committee. So for universities, for elite athletes, and we hope that that will start to trickle down to our phys ed classrooms, because we know for many LGBT youth, they simply won't go to phys ed classes or gym classes because they're not safe. Or when coaches are running drills called, smear the queer, Johnny, you're the queer, everybody attack Johnny. What kind of message does that say about these attitudes? So I think great things are happening. So the You Can Play project, we're proud to be partners at the University of Alberta under the leadership of Brian Burke in Calgary, one of the few times an Edmontonian will acknowledge something good in Calgary, but I'm happy to do so. And his son, Patrick Burke. In fact, we're bringing Wade Davis, the executive director of the You Can Play project, as our keynote speaker for University of Alberta Pride Week. We're proud to launch a new project, we hope, as well. You saw Andrew Ference, the captain of the Edmonton Oilers, march in the Pride Parade. And who did he march alongside with? Camp Firefly, supporting our young people. And he told me afterwards, of all the thousands of community events he had done nothing more meaningful in his life than march in the Pride Parade as an ally to help to break those barriers. And he said, this year, I'm marching with my wife and my 2 kids. So it's happening, but we need to engender and keep that conversation going. I used to say schools and sports were the last 2 bastions of tolerated homophobia and transphobia in our society, and my, how quickly sports have leapfrogged schools. And you know why? It's because of leaders standing up and not being afraid to break down those barriers, kick down those doors, create space and opportunity and possibility. You talk to Brian Burke, and he would say he would welcome any LGBT hockey player to play on his team, but you got to be able to play.
So I think we'll wrap up on that note.
Great. Well, thank you, everyone. I would love to be able to talk to you more. In fact, we're no shortage of passion. And feel free to contact us at the Institute. We're there for you no matter where you reside in Alberta or indeed in the country. The message I'll give you is the same one we give our young people. No issue too small, no issue too big. If we don't know about it, we can't help you. Reach out to us, because the issues that you bring forward are also issues that we take forward in conversations we're having with ministers and policy developers to, again, change the culture of our province. I'm tired of a province that's seen as a backward redneck province. That's not the reality of Albertans. And I believe we're a progressive, forward-thinking province, but we need to build that province together. We need to support every one of our young people, not just to survive, but thrive. They will be our future leaders. So we need to create the conditions that enable them to step up and take on those leadership challenges. Thanks again.
Well, thank you very much, Dr. Wells. That was a very informative and enlightening presentation. And you've given us all something to take away, especially recognizing that all youth are at promise. And I think that's something really to keep thinking about, and so much to learn. Great question and answers. So thank you again.
Great, thank you.
It's been wonderful to have you here. So just a few reminders for people for the future. I'd like to thank everybody in our audience, both on the web and in person today, for taking the time to be here. It's really great to see that. Our next session in the Children's Mental Health Learning Series will take place on February 3rd. We will be in Red Deer, and Dr. Kelly Dean Schwartz from the University of Calgary will present on managing children and adolescents with severe anxiety issues, a toolbox of strategies. So be sure to check out our website to register. Our website will have a copy of this recording and links to many of the resources Dr. Wells mentioned, and of course your website, so people can pursue any material that's interesting to them. For everyone who registered today, a follow-up evaluation and a link to the recording will be sent out to you by email. Your certificate of attendance will be emailed once you complete the evaluation, so please be sure to do that. And as I mentioned, this session will be online in a couple of weeks, so be sure to check out Human Services website under Children's Mental Health. And you should be seeing the URL up on the screen right now if you're on the webcast. So thanks again, everyone, and have a wonderful day. Great. Thank you so much.